Hello, I'm Dr. Bharti Vyavare, pain consultant from University Hospital, South Manchester. I welcome you all to my session on understanding pain and living well again. Normally, we relate pain to harmful stimulus or injury and expect pain to go away when injury is healed. It is confusing to an individual when initial injury is healed but pain becomes persistent. Sometimes pain starts without any associated injury and become persistent. The aim of my session is to learn what happens at physiological and cellular level to body when we are in pain. It will help you to understand some of the symptoms you experience and to make sense of treatment that we recommend to control these symptoms. I will also discuss the difference between acute and chronic pain. So it will help you to understand why treating chronic pain so difficult and it is frustrating for a sufferer. I hope you enjoy this session. Hopefully this will make sense of your symptoms and you will be able to manage it better to improve quality of life. So let's start with definition. What is pain? I would say it is whatever a sufferer says. It is very difficult to define pain. However, there is International Association of Study of Pain definition. And I would like to mention this definition here because it explains very two important component parts of pain. And this makes pain as a unique experience for a sufferer. The definition describes it as an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. So, because it is a subjective experience, it is very difficult to measure in units and also where every individual reacts to it differently. Some cry out loud, some are irritable, some feel angry when they are in pain, while some just sit depressed without expressing them to anyone. Now, when we talk about tolerance to pain, is it same? Obviously not. And that's what we experience in our day-to-day practice as well. If we have two patients having same operation, we need to appreciate that they may have a different requirement for pain relief because tolerance differs in individuals. What will happen if you don't feel pain? Is there a purpose for pain? For example, this person in the slide is running away from danger. If he felt no pain, he won't protect himself from danger. So actually pain is a warning signal to brain. It prepares us for fight and flight response. It protects us from harmful stimulus and also stores memories from past pain experience. Then depending on those previous experiences, our reaction to same stimulus varies. I'll give you an example. I'm an anesthetist and need to put a needle in the hand for putting patient off to sleep. It is an important part of my job. Once I came across a patient. As soon as I introduced myself as an anesthetist, she said, "Don't put cannula on my hand, but I am happy to have it at the elbow." So, just out of curiosity, I asked her, "Are you needle phobic?" She said, "Yes. I used to be needle phobic, as I had a very bad experience as a child." She was told that needle doesn't hurt, but it took multiple attempts. It didn't work, and she had a very bad memory of it. Then a year ago, she had a cesarean section for a baby delivery. At that time, she had a cannula put in at the elbow. It worked straight away at the first attempt. That new experience has changed her thinking and has no more fear about it. So, relearning and deconditioning from previous experience does occur, and it is an important thing. So, let's talk about what structures are involved in transmission of pain from from periphery to brain. There are three main structures involved in transmission of pain. First is peripheral nerves, which are specialized cells under the skin. They are like a cobweb network. From peripheral nerves, the information is passed on to the spinal cord, and from spinal cord to the brain. So, for each spatial stimuli, for example, temperature, pressure, electrical, chemical, and visceral, there are different specialized cells. These specialized cells, to become active, certain threshold stimulus has to reach. Then only the pain signals are sent to the brain. There is also a specific feature our nervous system have, that a normal touch temperature and pressure sensation is carried by different specialized cells. Also, the speed at which normal sensation carried to the brain travel faster to brain compared to the specialized cells carrying information for pain. We will discuss importance of it in further slide when we discuss about gate theory. Now, I will give you an example how the threshold is important. If you put a normal temperature water in a pan and put it over a gas, put your finger in this water and start heating water. There will be a temperature up to which you can tolerate keeping finger in water. However, at some point, the rising temperature becomes uncomfortable and you will withdraw your finger. That's the threshold for temperature where pain fibers are activated. Likewise, there is a predetermined threshold for each specialized stimulus. So, when there is a sufficient local tissue damage to cause release of chemical to create a sufficient threshold to activate specialized cells, then signals are passed up the peripheral nerves to the spinal cord and then to brain. Once the signal transmitted up to the brain, there is generalized chemical release, which is called adrenaline and noradrenaline in the body. This activates fight and flight response. You experience increase in heart rate, blood pressure, faster breathing. Your body feels shaking, limbs go tingling and cold. This cold limb is because all the blood from periphery push to heart and brain so that body can prepare yourself for fight and flight response. There is increase in muscle tension and difficulty in thinking. Your brain doesn't want you to think too long and wants you to take action. Hence, we find difficult to concentrate when in pain. It makes you alert, vigilant, aroused, activated, and ready for action. This is arousal response and makes people difficult to sleep. Hence, we notice difficulty with sleep when in pain. When injury is healed, this chemical response subsides and signals are switched off. However, in chronic pain, this signal persists even after injury is healed, and body experiences constant flight and fight response. Some of the relaxation techniques that you learn on this platform will help you to control these symptoms and improve quality of life. Now, this slide just explains how the specialized cells are connected to each other by fine thread-like network. And that explains, even if it is a pinprick injury at this level, supposed at this point, but you feel the pain widespread, not just at the site of pinprick. Because with pinprick, this nerve is activated and threshold is reached. Now this nerve is connected to the surrounding nerves and the information is passed on to wider network, and hence you feel the pain in wider area. The importance of this is when the pain becomes chronic, there is a constant stimulation of these nerves. Then longer the pain stays, more and more nerve fibers are getting activated. And it feels like the pain is spreading in a wider and wider area. However, that does not mean that the injury is getting worse. The response you feel wider is because the information which is transmitted to more and more specialized cells which are connected by thread-like network. So intensity of pain increasing or area of pain increasing does not correlate to worsening of initial injury. That is the most important message from this slide. Now we know that there is specialized cell for each type for painful stimulus. And again in that there are two types of pain fibers. One fast pain fiber carrying information quickly to the brain to warn about the danger, which helps to withdraw from danger. Then the second pain fiber sends slow information to brain to recognize which area is damaged and helps to protect that area. For example, if you hit your hand with a hammer or trap finger in the door, first response is to withdraw your injured finger from the stimulus. Then you feel stinging and numbness in the area of damage that prompts you to immobilize that part for healing. So let's summarize what we learned so far. After injury at the periphery, there has to be sufficient tissue damage for the specialized cells to reach the threshold. Once that threshold is achieved, the information is sent to the spinal cord and from spinal cord to the brain to the area of pain. As we know, for each specialized senses, example vision, hearing, and taste, there is a designated area in the brain for processing information. In the case of pain, information is not only sent to area of pain but also goes to area of emotion and memory. All these three areas communicate with each other. The information is processed in context of previous experience, memory to make sense of it. Then the brain sends message down to the spinal cord to say how much pain is felt. So, there is an information going to the brain and information coming from the brain that determines the pain intensity. Hence, pain is not only outcome of input to the brain, but it is determined by output from the brain. This output is not directly proportional to the input. The information may be modulated at the level of periphery by the situation at the specialized cells. It is also modulated at spinal cord, and final modulation occurs at the central level into the brain that determines how much pain is felt. Alteration in the how much pain is actually felt is called neuromodulation. There are numerous mechanisms by which the central nervous system can increase or decrease its sensitivity to stimulus from body. In some extreme example, desensitization can occur. If you have experienced major trauma or if you speak to someone who had major trauma, they will tell you that at the time of accident, they did not feel the pain. The pain sensations are completely blocked. The pain sensations are completely inhibited from reaching brain. It is also a protective mechanism. The brain doesn't want you to think too much and wants you to take action. Most of the time, an injury will increase the level of sensitization so that brain can easily protect the damaged area. When an area becomes sensitized, what happens is pain is felt sooner and strongly. So normally, non-painful stimulus become painful. There are many complicated mechanisms by which level of sensitivities increase or decrease. The key point is central nervous system is constantly adjusting the level of volume on the pain signals depending on variety of factors. It appears that in chronic pain, this volume is simply being turned on too loud and left on for too long. This is called central sensitization, and it plays some role in many chronic pain states. This explains how in chronic pain, increased pain intensity does not imply continuing damage to body. Brain can amplify the signal or turn it down or even tell the nerves how much of the signal to send up in the first place. Nerve sensitivity can be set by brain or by condition in the tissue which we discussed. Even the structure of the nerve can and does change. As we know that pain process involves area of emotion, context of pain is important. I have just put up this slide. It is a soldier in warfield. There is a study done, it shows soldiers don't feel pain in the warfield environment. The reason is it is rewarding to be alive and safe. Pain is felt later on. We also see players during matches carry on despite injury. Pleasure of game is so dominant that they do not feel pain at that time. So positive emotions does play a role in reducing pain. So far, we know how much pain signal to transmit to brain is controlled by various factors. There are factors at the periphery where enough threshold has to reach at the level of specialized cells for pain signals to be initiated. Then there are factors in the brain depending on previous experience, emotional state. They all play a role in controlling how much pain is felt. Similarly, at spinal cord level, we call it as a gate control theory, which is based on the principle that the normal touch is carried by different fibers than the pain sensation. Hence, in day-to-day life, normal touch, temperature, pressure is not painful. In this slide, A beta is a fiber which carries normal sensation to brain, and A delta and C is a pain fibers. Both when activated will travel this pathway to reach the brain. So you can see they travel on same road to reach the brain. On the same pathway, there is some control from the brain itself with what's going on at brain level. So this gate will open for the pain when the pain fiber starts carrying information to the brain. In this current state, neither the touch fibers nor the pain fibers are activated. No information going to brain. Now we know from before that if touch fibers are activated, they transmit information at faster speed to the brain, while the pain fibers, they travel at slower speed to the brain. Now we'll go to next slide. Now this slide, you can see pain fibers are activated. They are starting to send information up to the brain and gate is open to pain. Pain is felt, while touch fibers are not activated and sitting quietly here. Now in this slide, a touch fiber is activated as well as pain fiber. And when both fibers are activated, because the touch fibers are carrying information quickly and fast at the roundabout, the touch fibers are coming from the right side at higher speed and constantly coming and stopping traffic from left. Hence, pain fibers not able to go round this pathway to the brain and gate is closed for the pain fibers. No pain is felt. This you experience in day-to-day life. Whenever you are injured, first thing you do is rub that area. When you rub the area, you feel better for that time period. The reason is by doing so, you are activating touch fibers, and that blocks the information of pain temporarily reaching the brain. Now let's summarize. What opens and closes the gate for pain? Pain nerve activity opens the gate and other sensory nerve activity closes the gate, such as rubbing, acupuncture, acupressure is based on same principle. Some of you might have experienced that having massage acupuncture helps, but it is all temporary benefit. Also, positive messages from brain can close the gate, while negative messages open the gate for pain. This slide shows acupuncture, if anyone has experienced it. It is based on gate theory, and this other picture showing how TENS machine is applied, that is also an example of gate theory. So, I'm just going to summarize conditions that open and close the gates. Physical condition such as extent of the injury opens the gate, while medication closes the gate. Inappropriate activity level opens the gate, and hence it is important to know what is appropriate activity level for individual. And that is what you learn from this program. Counter stimulation, example massage, acupuncture, TENS, helps to close the gate. Emotional conditions such as anxiety or worry, tension, depression opens the gate and makes the pain worse. The condition that closes gate are relaxation, distraction, appropriate resting. Mental condition such as focusing on pain, boredom makes the pain worse. While intense concentration, distraction, and involvement in activity of interest helps to close the gate. These are the things we can add in addition to your medication and whatever treatment you are offered so far. So, in 16th century, we felt that the pain has very simple pathway. You have an injury, the information goes to the brain, and you feel pain. But with advanced technology and improved knowledge, in 21st century, we know more about pain. We understand that pain is not only dependent on input to the brain, but it is the output from the brain which is modulated at various levels. There is a peripheral, spinal, and central sensitization. It is also affected by prior experience, your attention, expectation, your mood, anxiety, or depression. Also, neurochemical and structural changes that occur in the brain and any genetic factors that may be contributing. In addition, sensitization that we talked about, either at peripheral or central level. So, output of pain dependent on various factors, not only on extent of injury or input to the brain. Let's see the difference between acute and chronic pain. Acute pain caused by injury to the body. It warns of potential damage that requires action by the brain. It is a very important factor in acute pain. It lasts for a few minutes to less than 6 months and goes away when the injury heals. So the chemical response that is initiated by injury is switched off. In chronic pain, pain persists long after injury has healed. The chemical response that was started after injury is not switched off even if injury is healed. In some cases, it occurs in absence of injury. That becomes more confusing for individual. However, whatever it is, chronic pain does not want the body to respond, as there is no ongoing damage. That is the main reason that needs different approach to management of acute and chronic pain. So in chronic pain, after tissue injury, the pain signal is turned on, but it is not turned off. And chemical response is not turned off after injury is healed. It causes more and more sensitization at periphery. More and more specialized cells are activated. Threshold is reached more and more signal is sent from periphery to the brain. So there is overactive ascending pain pathway. Your mood is low due to pain and its impact on quality of life. Hence, no inhibitory effect from brain in turning down the signal. It causes malfunctioning of the descending pain modulating pathway. Whole pain pathway is malfunctioning and body is in a constant fight and flight mode, but no ongoing threat. So I'm just revisiting this slide again. Suppose injury is at that point, but because chemical signal is not switched off, more and more nerve cells are activated. It feels like pain is spreading. As the threshold is already reached, slight temperature pressure is more painful. It feels as if pain is getting worse. But actual scenario, what is happening is whole nervous system is sensitive and hence pain felt more. That does not mean initial damage is getting worse. What that means, even if it is hurting more, it is not causing any further harm. It is an important message to remember. Now, watch this picture for a few seconds. There are two men running. I'll show with pointer. This man is running as the dog is following him. But the other man is running, but he don't know why he is running. Can you just think what is going on with these two men? What is the chance of this man stop running at some point as opposed to this man? I'll explain this as we are not face to face, can't expect answer. The man at the top is someone who is in acute pain because there is a danger causing fight and flight response. But this acute injury is going to heal and this man will stop running. Because if the dog is distracted, he's not following him anymore, he will stop running. But this man, there is no danger behind him. By running, he is not going to achieve anything. There is no end point, he is still running. He is going to get exhausted at some point as he can't decide a point where he can stop running. This is someone in chronic pain because body is in a constant flight and fight response. You're constantly under surge of adrenaline and noradrenaline, and it is not useful as you don't need to protect the part of the body for healing. You're not getting anything as compared to when you're in acute pain where injuries need to heal. In this situation, injury is already healed, but chemical response is not switched off, and that is keeping body in this state. I hope this slide helps you to understand acute and chronic pain better. So in chronic pain, just resting is not beneficial in long term. What is required is adequate balance between resting and activity. So in summary, pain is a survival mechanism and its purpose is to protect body. It is an output of brain, not an input from the body. The physical harm does not equal pain and vice versa. The brain often thinks body is in danger even when it isn't. Pain can be triggered by factors unrelated to physical harm. Our central nervous system can change its sensitivity level to pain. Important message from this session is in chronic pain, what looks like this actually feels like this. Important to remember is even it feels like this, hurt is not equal to harm. I hope at the end of the session you have a better understanding of your symptoms and some of the techniques that you learn on pain management program, how they benefit. If you have any question, let the team know and we'll answer it on appropriate platform. Thank you very much for listening. Any comments are welcome. Thank you.